Hello, I'm Dr. Warren, and I want to run through a question I get frequently, which is how long does it take for Lyme to kind of switch from this acute into this chronic form? And the reason people ask is because when you initially catch Lyme, the general treatment that people recommend, which is doxycycline, works really well. And then in chronic Lyme, it doesn't work very well. And so when does that transition happen? How long of a window do you have to kind of treat this as a very simple disease? And when does it become something more complicated? Let's run through some research today. I'm going to share some research that's extremely new, just a few weeks from me recording this, not even a month old. So the question is, how fast do we need to get you doxy for it to work? And when does the success rate start to go down? So first off, we have articles about this, but in July of 2023, the NIH came out with a research grant for chronic Lyme. First time it's done this. And they say in the opening of their research grant that we have about 476,000 cases of Lyme a year in the United States. And we've got about a 10 to 20% fail rate of people who are going into chronic Lyme, or what's called post-treatment Lyme disease syndrome. I will tell you these are estimates, but let's start to look through some studies of kind of get an idea of that 10 to 20% fail rate. Here is a study also, which we've referenced in other videos, non-specific symptoms and post-treatment Lyme disease out of Belgium. And this is a 2022 study, and what they did is they took people who got antibiotics within about 30 days, and in one group we have about a 6% fail rate, in another group we have about a 20% fail rate. This is important because the 20% fail rate is when you have disseminated body-wide symptoms. So we have body aches or pains, neurological symptoms, but you have body-wide symptoms. The lower success rate is if you only had the bullseye rash but didn't have a lot of other symptoms. Now, most people who I encounter are in that disseminated category, meaning you have joint pain, this looks like an arthritis, or you have neurological symptoms. You know, we're bouncing around to neurology or rheumatology or possibly ER visits because we're trying to figure out the weird symptoms that are coming. If you're getting those body-wide symptoms, we've already at 30 days got about a 20% fail rate. It's really high. Now, what if it takes longer than 30 days? When I'm in the office, I see many people who it takes months, maybe you bounce through the system a little bit before a doctor figures out it's Lyme. Well, can we get any studies where maybe it took 6 months? Sure. So here's a study out of 2012 where we take a bunch of rhesus macaques and we infect them with Lyme, wait 4 to 6 months to do the doxycycline therapy. And guys, basically they say it didn't work. It really didn't work at all. So we've got this 10 to 20% failure rate by the time you're 30 days in. Guys, we really have a terrible success rate by the time we jump to about 4 to 6 months later. Can I get like a 60 or 90 day study? Sure, and this is one of the newest studies that it's come across on a couple different Lyme communities, and let's take a look at it because they have a 60-day time window. Okay, superior efficacy of combination antibiotic therapy versus monotherapy in a mouse model of Lyme disease. Now, this is important because the general guidelines from the CDC that most doctors follow and from IDSA is monotherapy. It's doxycycline. It's one drug. It's not a combo. And this is out of Tulane literally in November of 2023, and you can read it right from the title. They're going, the current recommended doxycycline stinks. And they're going to recommend a more aggressive treatment with multiple combined antibiotics. Now, I've had people ask me, is this new thinking? And I'll tell you, in the Lyme community, it's not new thinking. They've been on this since the 90s, that because chronic Lyme is such a serious thing, we should be more aggressive on the front end. But what we want to highlight here is that by 60 days, which is what they did in this study, the standard monotherapy is not working. Let's jump into this study. So we take the mouse, we give it Lyme disease, we wait 2 months, then we do the antibiotics for a month, then they wait 2 more months, start running tests, checking for things. Now, here's what they really found. I'm looking at the table in this study, because the first thing they say is that the monotherapy doesn't work well and that combo therapies work better. We'll do a whole nother video on combo therapies and different options there. If you're watching videos from me, you may know that chronic long-term multiple antibiotics can work, but it's a hard way to do it. I think natural can beat it when you're dealing with the chronic stuff, but we'll go into that more later. For this purpose, we're trying to figure out when does it switch from chronic to acute. Okay, by 60 days, these monotherapies aren't working. But there's a problem with this list. Aslocillin, 4 out of the 5 mice were still had a positive culture. Bactrim, 5 out of 5. Disulfiram, 5 out of 5. Carbamazepine, 5 out of 5. Dapsone, 3 out of 5. Rifampicin, 3 out of 5. Okay, cefotaximine, 1 out of 5. And you might have noticed it already. This cefotaximine looks actually okay, 1 out of 5, working somewhat. But there's no doxycycline on this list. It's the most recent study we have out of Tulane that's causing a buzz. Why isn't doxy on this list? I read their conclusion and they go, well, by 60 days, antibiotic monotherapy doesn't work. Our results support past findings that monotherapy does not eradicate Borrelia burgdorferi infection in all mice. It leaves a subset of mice with persistent Borrelia burgdorferi infection. Okay, so they're saying this isn't going to work. By 60 days, this isn't going to work, and we're going to have people with chronic Lyme or post-treatment Lyme. Okay, but why is there no doxy? Doxycycline, this is directly quoted from that study. Doxycycline and ceftriaxone, but let's just say doxycycline, were not included in this study. They are well studied and are not effective at eradicating the persistent form of Borrelia burgdorferi. And they give several references. Wow. Now, I disagree strongly with these researchers from Tulane. I think you should include doxycycline in this study of the monotherapies because it is still what is recommended by the CDC. It is still what insurance covers. It is still what is recommended by IDSA is, well, do the recommended guidelines. So when you go to your doctor, they're going to tell you, well, doxy works. And when you go to infectious disease, they're going to tell you doxy works. And here we have the researchers is at Tulane. This is an exercise in how different the research community is versus the doctor communities and the guidelines and what the insurance does is the researchers are saying it is so well established that by 60 days, the chronic Lyme, the doxycycline will not work, that it's not even worth us putting it in the study. Wow. Does your doctor know that? I don't find many doctors that know that. And yet here in the research, they're going, it's so well established, we didn't even bother putting it in the study. Okay, so superior efficacy of combination antibiotic therapy. I will go through the combinations and that kind of thing in another video. Just note, none of this is new. This is kind of stuff we've been saying for 30 years. Exciting to have some studies showing it, but the monotherapy really did not work by 60 days. So how long does the doxy really work? Well, at 30 days, it's got a 10 to 20% fail rate. By 60 days, it's probably not working. And by 4 to 6 months, it's definitely not working. And your doctor doesn't know that. Your infectious disease doctor doesn't know that. Your rheumatologist doesn't know that. Your neurologist doesn't know that. They're just taught, oh yeah, 2 weeks of doxy works, even if it took you 6 months to find it, even if it took you a year to find it. It's just not true. You gotta find this stuff early for that simple therapy to be effective. Now this is kind of what we've been harping on for years. If you catch it right away, but that's really looking like an increasingly short window, 30, maybe 60 days. We take antibiotics, get better, it's all over. But once it's chronic, that simple, 10 days of antibiotics does not work. 14 days of antibiotics does not work. It is going to take a more robust plan and program. They go in on this study to say if we think about it like TB, that's probably better than thinking about it like strep, because TB is a 6 to 18 month protocol and strep's a 10-day protocol. So once you're in chronic Lyme, we need to do something to kill Lyme in the different phases. You need to help the immune system. You need to rebuild raw materials. You need to help the body heal. It's going to be a more robust long-term program. For us, that's usually 6 to 18 months, not 10 days. Not 10 days. Now, remember, this study has major problems in that there's no co-infections. And when I deal with people who are sick from Lyme, 93% of them have co-infections. So I want to see studies where we give these rhesus macazer mice Lyme plus Babesia, or Lyme plus Bartonella, or Lyme plus Anaplasma, or Lyme plus Powassan virus, because that's what practically walks into my office over 90% of the time. And so I think these studies, while wonderful to be progressing the science forward, still have huge holes in what they're showing in order to get to the reality of what I'm seeing in the office. You can be better, you can heal. But if you're outside of now that 1, maybe 2-month window, it's going to take a more complete and robust Lyme and co-infection program than 10 to 14 days of doxycycline to get you better. Hope you found this helpful.